Hi, I'm Callie Lux, Workit's community lead, and I'm here with Chrissy Taylor, our director of counseling, who's coming to us from Denver, where she is at the conference, National Associate of Addiction Professionals. Yes.
Mm-hmm.
And today we wanted to talk about the difference between Suboxone and Vivitrol, because this is a question that I get a lot,
Mm-hmm.
and Chrissy, I'm sure that you get it a lot. So I wanted to talk
Yeah.
about a little bit about the differences between those two. I have taken both in sort of forms. I've tried the pill form of Vivitrol, but I never made it to the shot. They gave me, when I was in rehab, maybe 2 or 3 weeks in, I took Suboxone for detox, and then they suggested that I take Vivitrol, but they gave me a pill form of Vivitrol to try it and see if I would have an allergic reaction. And I just hadn't been off of opiates long enough, I think. It made me feel a little dope sick. So I did not continue down that path, but many do. And Chrissy Taylor, what are your thoughts on Suboxone versus Vivitrol?
Well, I understand people's desire and the idea, especially for family and friends, about the Vivitrol, about how it just, you give a shot and then it's good for 30 days. The thing that I think that is missing is that when you have Suboxone, you have almost a little bit of a carrot. And that carrot is that you get it for a week. And then you have to make sure that means that every week you have to talk to a professional in order to get that help and to get, the things that you need. And I think even when somebody has the best intentions about being sober and staying sober, I mean, everybody knows how life gets. And all of a sudden, when you have the Vivitrol in you, it can be, those things can kind of go by the wayside, the drive can kind of go away. I think also from like a medical standpoint, so Vivitrol is going to be, it's just going to block. It's going to block if you take opiates, but it's not going to actually activate those receptors at all. And kind of what we think is that you need to almost activate those for a little while you're going through some of this post-acute withdrawal to get your brain reorganized. And, and any time you give a shot of something for, for 30 days, it leaves not a lot of like a lot of leeway to, doctor it, because you've been given a shot. It's there for 30 days. The other thing that I think, from more of I don't want to say political / marketing view I have, is Vivitrol is primarily marketing to judges. And while I get that technique, I understand what they're doing. I think that they're missing some of the bigger picture. I have spent this entire weekend going to everything related to opiate addiction, everything related to medically assisted treatment. And what I've heard from a lot of the professionals in the field is that, first of all, Vivitrol is very expensive. Vivitrol is not cheap. And they make you the clinic pay cash for it in order to have it on hand. And while that shouldn't be a barrier, like, let's be real, it's going to be a barrier. Sure. And a lot of people think that Vivitrol is really great at the end of your taper. At the end of your taper, when you kind of need, that extra push. But, what a lot of the professionals and kind of what we see and what we feel is that it's kind of like when you're trying to quit smoking and you do the gum or you do something, it's that hand to mouth. It's that needing to take to feel different, and that they think that that's really important. And I mean, for me, I think the most important reason why I feel like Vivitrol maybe shouldn't be the first thing that somebody looks at is that post-acute withdrawal, is that getting the brain chemistry back together.
Great. Yeah, because Suboxone is actually not going to be entirely a blocker. It's not going to be an opiate blocker. And Vivitrol is, correct?
Mm-hmm.
Okay. Yes.
Yep. It's going to completely block it. So if you tried to do drugs, you just wouldn't feel the effects.
Sure.
But you're not, but the thing is that what people, I think what people know, but what they don't always realize takes so much time to readjust, is that if you've been doing opiates for a while, your brain chemistry and the way that your brain is used to working is completely reliant on the fact that you are taking these medications, so that when you stop taking those medications, your brain goes, what? And it takes a long while to get your brain back to its normal self. And so kind of like while your brain is doing that, that's the time, one of the speakers I spoke to yesterday, talked about it brilliantly and said, like, that's the time when you're taking the Suboxone while you're still kind of getting that activated, getting that what your brain's normal. That's the time when you work on the job, when you work on getting the kids back, when you work on getting a car, when you work on all of those kinds of things, so that eventually you could maybe do a step to something like Vivitrol.
Great. Yeah, that makes a lot of sense. I know when I quit opiates, life was really raw and it was just learning how to be a person again, So something like Suboxone maybe makes a lot of sense in that period. So thanks so much, Chrissy Taylor. It was great talking to you about the differences between Suboxone and Vivitrol. I hope you enjoy the rest of your Addiction Professionals Conference. Okay, have a great day.
Thank you so much. Always fun talking to you.
Okay, bye.